I'd like to thank Dr. Tan and Ms. Stiggy for inviting me and asking me to join you all. And I asked myself, why am I giving this talk? And I think part of it is that Dr. Tan has been nice enough to invite me the last couple of years, and I've never actually had to stand up in front of slides, so I think he wanted to know if I could actually do it. I'm a physiatrist. I'll talk a little bit more about that, but the point is that my profession in physical medicine and rehabilitation works with teams, and so it's a wonder and a joy and a real pleasure to work with the team at Mayo Clinic. And in rehabilitation medicine, we think of the team as everyone beginning with the patient, including their family, including all the other clinicians and all the support staff. So we all think of these people as a team. And not so much as a football team where you have a quarterback, someone who's in charge. Everybody has an equal say. It's sort of socialist. But anyway, the idea is that we're all working together for a common goal. We'll talk a little bit more about that too. So I don't do things to people. Some people in my profession do, but my job is to convince people to do things for themselves, and that's somewhat of what we're going to talk about today, how that can occur. With rehabilitation medicine, we move from the patient being a passive recipient to an active participant in their care. So all the great work that Dr. Knudsen's doing, he's not going to ask you to even insert the vaccine. He wants you to hold still. My job is to get you to do this for yourself. So why exercise? We'll talk about exercise in general initially, and it's because you're going to feel better. We just had the Olympics, and you can see what happens when people sort of push themselves. They get bigger, they get faster, they get stronger. There is improvement from an emotional state. There is data to support an improvement in immunity. Now, I will not say that that exercise is going to change your immunity the way Dr. Knudsen's work is going to change your immunity, but at least we can get things in a sense of thinking of it as all hands on deck. So we can get all those, the rest of the immune system all ready to go so that it will help, it will make a difference, and then the other treatments that you undergo or that an individual undergoes can help things work even better. It's going to help you do more, do better, more mobility, more independence. I think one of the biggest challenges that anyone has as a patient with any type of illness is the loss of control. I work with a lot of patients who have pain disorders, and that's the common theme, that these individuals feel trapped. They feel that something is happening to them. They didn't do anything wrong. They didn't have any say in this, but this is happening to them. And if we can give them control, help them understand how they have influence over their situation, that makes a huge difference. At least that's what I believe, and that's what they've told me. We learn more from our patients. It sounds trite. We talk about how we learn so much from our patients, but we do, because every interaction is, in a sense, either a validation of what we believe or is an opportunity to teach patients, teach individuals what we know, and then to hear back, did that work? And so we learn constantly, and that learning helps us to impart that information onto the next person. So rehabilitation is restoring abilities, regaining function, getting back to what you've lost. I like to think of it as you misplaced it. You're not doing things that you were doing before, but you can get those back. So it's not a final situation. There are requirements. There's things that we want people to have to come to the table. If you can remember what we've told you, that helps. If you can't, we can work around that. If you're motivated, if you want to be better, if you want to do more, we can help that. And it helps to be able to move. Now, movement can be as little as very little. So my profession works with patients who've had spinal cord injuries and brain injuries, And so people who can just move their eyes can function. But people who have more movement than that, people who can stand up, people who can move their head, people who can move their hands and arms, they can exercise. That counts. We'll talk about that. And that can make a difference. That's a start. So movement's key, my opinion. There's physical exercise, and then there's physical therapy. I had to throw out at least the acknowledgement of our occupational therapists too, because there might be some in the room and they'll be on me if I don't include them. They're all part of the team. So how does this all fit together? Exercise is like good food. It's like good nutrition. Physical therapy is like the right medicine. So physical therapy is more specific. Patients will come in, well, do I really have to go see the physical therapist? I mean, I exercise. And if they're moving, if they're doing things, if they're achieving what they want to achieve, well, no, they don't have to go to physical therapy. It's not necessarily a requirement, even though I'd like to make it a requirement. But if they're not doing as well, if they're not accomplishing what they want to accomplish, then specific interventions, either adaptations. So for instance, I think of some of the implements we use that people are familiar with, like eyeglasses. I can't read the board if I don't have eyeglasses, so I wear eyeglasses. It's a minor inconvenience to allow me to do something I otherwise wouldn't be able to do. So those types of adaptations or compromises can make a huge difference in a person's life. On the other hand, we, on occasion, can restore function. Many times can restore function. I'm not strong enough to lift a gallon of milk. Well, okay, can you lift a half a gallon of milk? Well, sure, fine. Now we've got a baseline, we can start to move from there. Well, maybe you can only lift the pint of half and half. So, well, then again, new baseline, but doesn't mean we can't accomplish the task that's set out, that we and the patient agree to. Now, a lot of my examples wind up being fairly mundane, but if you can't lift that gallon of milk, that's a big deal. If you can't get out of a chair, that becomes the difference between you living alone and you living on your own, or needing someone with you all the time to help you up. So there's a huge impact associated with even small improvements. Physical activity is empowering. Success, accomplishment, setting a goal and achieving it, that's a good deal. Many of us will make lists. You know, what do I have to do today? And put up a list, and then you cross off those lists. Sometimes it's nice to make those lists as silly as possible. So, okay, my first job is to get out of bed. Great, check that off. There's a YouTube video from a Marine Commandant talking about the first thing you should do when you get up in the morning is make your bed. Because if you've done that, you've accomplished something. Everything's set, you're now moving forward. So any activity, and that counts. Making your bed, that's a big deal. I can't. Fortunately, my wife's very supportive of me, and she'll make my bed. But those types of physical activity, those all are important and count. So, how do I get started with all this? Well, you need to talk to your provider. Just so, I don't think we brought the lawyers here this time, but just so that everybody said, no, it's okay to exercise. Patients often fall into, or all of us fall into two categories. There's some of us we need to hit with a cattle prod and just sort of, you need to get going here. Some of us we need to be reined in. So I have a friend who just got out of the ICU, and the first thing he wanted to do was get out on his boat, and the problem was he lives in Massachusetts, and there was a nor'easter coming. It was like, you might want to take a day off. Just don't go out. So. But those people, they need someone to tell them to hold back. And then the easy answer is, well, just go start exercising. And that's not always specific enough. So let's make it a little bit more specific. Well, when you do something, when you do anything, you're making a choice. And your choice is, I'm going to do too much or I'm going to do too little. It's never perfect. And that's fine. So what I'm telling you to do, I'm giving you permission. You can say, your doctor said, do too little. So you want to go for a walk. How much should I walk? I think I can walk for 20 minutes. Do 10. Say I'm going to do 10. One of two things is going to happen. If you're going to finish the 10 minutes, you're going to say, that was easy. I could have gone longer. Fine. So, but you achieved your goal. On the other hand, you're going to say, hold it, that was terrible. I mean, I didn't realize I would be so worn out at 10 minutes. Well, good thing you didn't go 20. If you've established a baseline, if that 10 minutes was too much, wait until you feel up to it again, day or so, do 5, do 3. I had one patient who, honestly, she was an engineer at IBM, and she started in a minute. And we would use this criteria, increase by 10 to 20%, not minutes, 10 to 20% per week. She came back to me after a few weeks, said, I'm doing great. I am walking for 8 minutes and 43 seconds. Said, you could round it. Oh, no. This is working. Nothing else has worked. This is working, and she had this huge spreadsheet, which she could understand, and she knew how to figure out the Excel. And she was so pleased because now she had increased her activity, where before she would fall into a problem of always exercising too much and then having to stop. So if you make it too little and you can exercise, that's great, then you can increase from that baseline. When I think about that 10 minutes, studies have been done on patients with cancer-related fatigue, either associated with the disease or associated with the treatments, and they found that as little as 10 minutes at a nice, comfortable, relaxed, whatever pace, doesn't matter how far you go, but that will decrease your fatigue, that will increase your energy. That's true for the rest of us too. I think one of the areas of interest is, well, how far can we push? How hard can we push? But that's not really the point of this right now. The idea is that you can do, any one of us can do things, and it will enhance how we feel immediately. So if you're trying to exercise to a certain goal, I have people focus on time. And the reason is that if you're having let's say you walk and when you were feeling well, you walked a mile, and it took you 20 minutes, and you want to be able to walk a mile. And you say, okay, I'm going to go out and walk a mile, and it's going to take me 20 minutes, but you're having a bad day, but you're motivated. And so you go out on that bad day, and you're motivated, and you're going to get that mile in no matter what, and now it takes you 25 minutes. So now you exercise for 25% more, and you were having a bad day to begin with, and you're even more tired. I'd rather you go for 3/4 of a mile in the 20 minutes and say, I accomplished my goal and not be worn out, even if it was less than that. So I use time because then it's easy to just gradually increase the number of minutes week to week. So as little as 10 minutes can be great. Many, just in general, say, how much should I exercise? And everyone will tell you it's 30 minutes most days of the week. There's 7 days in a week, so 4 or 5 days. But you should be up and doing stuff every day because it's not like you're going to stay in bed the other 3 days of the week. So something every day is the appropriate amount. So what about strengthening? Well, we talk about, getting up and moving, but there may be a lot of me to move. So what about getting stronger? The biggest weight you need to move is you. So you don't need fancy equipment. I don't think we have any health clubs that are sponsors. But that's why I have no disclosures or no one pays me, because I don't endorse this. Joe Weider and or Life Fitness won't pay me to tell you. You just need to walk around. The sneaker companies won't pay me because there isn't always good data that you actually need a $150 pair of sneakers to walk around. So just being able to get in and out of a chair, going upstairs, you don't even have to go up all the stairs. Even if you were just working on one stair at a time, that's important. Your groceries. So even if you don't bring them in, if you put them away, if you pick them up and do a few repetitions putting them away, well, I don't know if I can handle that carton of milk. Gallon of milk is 8 to 10 pounds. Well, what about the can of peas? Well, you know, can you lift the can of peas? Can you lift it a few times? That can make a difference. Let me explain why. Your muscles can't count. They do not care if it's a can of peas. They don't care if it's a nice fancy pink coated dumbbell that's 5 pounds. They only care that you've got something and you're moving it until they get tired. Because when they get tired, then you start to get, they say, well, I'm gonna need more here, I need more help, and so you make little more nerve connections and you make little bigger muscle fibers. Muscles aren't just one thing, they're made up of little bunches of muscles. It's a team, they all work together, and when that team can't handle the task, you get more reinforcements, the body makes more muscle fibers, or the muscle fibers that are there get bigger. That's what strengthening is all about. It's not that, it shouldn't be that complicated. So you don't need a lot of stuff, you just need to work those muscles till they begin to get tired, not exhausted. It shouldn't be a matter of, well, I did so many squats that I couldn't get up, and then I stayed in the chair for the next 4 hours. That was good effort, but that may have been a little bit too much. And so that just tells you where your baseline is or where your baseline isn't for the next session. So I've been talking, you know, there's a lot of stuff here. I mean, it's percentages, we're talking counting. This is where, for many people who are dealing with a lot of other stuff, this can be a little bit much. And sometimes it's not that general. So it's like, you know, doc, that's great. I'm having a lot of trouble with that whole getting out of the chair business. It's not a question of wanting to walk. I want to walk, but I have a limp, I have weakness, I have knee problems. What are my other options here? Sometimes you need a coach, and that's where the physical therapy comes in. The physical therapists, they can teach you what to do. They have special skills, they can teach you special skills, different ways to do things. They can encourage you. Maybe you do need that cattle prod. Maybe that encouragement just is a matter of getting out of the house and going to physical therapy. You know, can I have someone come in? Yes, but we like to describe it as the therapeutic milieu of the therapy department oftentimes can be rewarding. There are studies that show that people who exercise in a group actually do better, work harder, feel better, enjoy it. And you don't even have to talk to the group. My wife was an avid swimmer all through her first pregnancy, anyway, the first time we had a child. And when we went on vacation, she missed a couple of days, and all the other old guys that are probably like my age now, anyway, that were at the pool were like, where were you? She's like, who are you people? Because she'd never really conversed with them, but they were all in the pool and swimming at the same time, and they knew when someone was missing. And so there's a lot of support associated with that. The other point, on the other hand, the therapist can tell you when you're doing too much. They don't act, you don't always think that the therapists are watching, but occasionally, you know, you'll be working and they'll say, okay, you can stop. It's like, why? It's like, trust me. And it's because they can read your body language. They have an understanding of what people can and should be doing. Let me stop for a second and just explain where I fit into this. I'm a physiatrist, oftentimes pronounced physiatrist, though when the term was coined, actually in Rochester, by the founder of the field, he went away from physiatrist because it sounded too much like psychiatrist, and we were confusing enough without being confused with psychiatrists. We're also not physical therapists. I have ultimate respect for what the physical therapists do and their hands-on approach, and I couldn't do that. I get to tell them, I get to suggest what they should do, but I get to diagnose and work with patients. I'm a doctor, and they're doctors now too, but so it gets even more confusing. But my job is from a diagnosis and treatment and then other interventions. The physical therapist, on the other hand, is not a personal trainer. People would say, I really want to go to therapy, I'd like a massage. It's like, it's not going to work that way. But personal trainers and massage therapists have a tremendous role in terms of being able to help people with some guidance. And so we work, this team gets fairly big and robust over time. Just in general, the physical therapists will work with big muscles, big goals, big things. I want to walk around the block. I want to get out of bed. I want to be able to lift things over my head. It's more fun. People love physical therapy. And they love their physical therapists, which is great. The occupational therapy, it suffers from the name because it sounds like work. It's not just work, it's not about your job, it's about what you like to do on a day-to-day basis. So the occupational therapists address what you do once you get up. So I've got up, it's like, well, now I want to make tea. Okay, so that's where the occupational therapy goes in. Secret, one reason I went into the profession is that when you're working with patients in our inpatient setting, they would have to cook because that's what you need to do to be able to go home. And so we'd often have pretty good food. So all my patients were required to make chocolate chip cookies before they could leave the hospital. Therapy's teaching, and that's the operative word, because once you've learned, it's up to you. You're in charge. Now, it's not all exercise. People will say, I can't go to therapy. I'm too tired, I'm too hurt, my ankles are swollen. I've got a variety of ailments that are I've got too much pain. Therapy works on that also. So we think of the first goal of therapy is to get the pain under control, and then rehabilitation, restoring function, can start. There's more than one way to do things. This is particularly true in occupational therapy. We all know one way. I tie my shoes one way. But if I couldn't tie my shoes that way, is there another way to do it? The answer is yes. The occupational therapists know all the ways. The physical therapists know all the ways to get in and out of the bed, in and out of the car. It can be very frustrating. Patients will come in, I can't put my pants on because I can't stand on one leg. Like, I don't know that that's the only way to do it. So sometimes just informing people, showing people, training people can make a difference in the immediate term, and then they can get to this point where they're strong enough to stand on one leg. The rehabilitation's all about goals. So this is why we do this. So the real question, and the question I often ask patients, what do you want to do? So my patients who come in and are exhausted and they're in pain say, I just want to feel better. I don't want to have as much pain. And I'll ask them, well, how do you feel now? Well, I feel pretty good. And I'll say, well, that's good. So you can stay in my office and you can sit there and you won't have any pain. You've reached your goal. And they look at me and say, no, that's not what I want. I don't want to have pain when I go to the grocery store, when I go to church, when I go out dancing. Say, okay, now we're talking about goals. So that's what you want to do. So what do people want to do? So when they've asked people what they want to do, they want to travel. They want to travel around the world. They want to travel around the block. They want to go places. They want to do things. That's going to take movement. But that becomes motivating. They want to do stuff that they want to do. I want to finish that crochet piece that I've been working on for the last 20 years. I think my mom has been saving up a variety of projects, and I'll worry when she finishes them. So that there's always something there may be something that someone wants to accomplish, but that often requires some physical activity, some physical interaction. The life milestones. People talk about, well, I really want to get together with the family one last time. I'd like to go out to, see my old hometown. I want to go to a reunion and see all my classmates who are worse off than I am. That's motivating. I'm not judging. It's if that's what gets you out of the chair, I'm all for it. Some people, we don't like to talk about finances or money, but sometimes it's a matter, saving up for this, or I just need to keep working on this, and then I can move along. Now, I don't think that should be, there's always more work to do, but for some of us, that's important. People have projects, people have things they want to accomplish. I want to finish this book, whatever. So sometimes that can be a matter of what will it take in terms of energy, fitness, activity, movement. Quality time with family or friends, not the reunions, but sometimes the one-on-one. A few years ago, my wife and I were traveling, and I have an inordinate number of nieces and nephews, and we decided to visit them because they were on the way. And it was a whole different experience because now we get to see college-age students who are a little younger than our children, but we got to go out to dinner with them and talk to them and find out what they were all about, which was a whole different experience. And so this is that could be an opportunity, a motivating factor that, okay, I want to do this with my children, my grandchildren, nieces and nephews, friends that I haven't seen in a while, just to have that experience because I want to have that experience and I think it'll be enjoyable. So daring activities can also include spending time with family or friends. Thanksgiving at my house can be a full combat sport. So sometimes you have to get in shape for that sort of thing, but sometimes it's a matter of doing something that you haven't done or wouldn't think you'd do. At the funeral for my 98-year-old grandfather, his 92-year-old cousin was there who had never ridden a motorcycle, and of course my cousin, who is an emergency room physician, arrived on a motorcycle. So we seized the day, and my 92-year-old great cousin went off on a motorcycle with my cousin, and we all just shook our heads. But it was a tremendous opportunity. He had a great grin, and he swore he'd never do it again. But at least he could say he did it once, and he didn't have that doubt or that question. So motivation and movement become the keys to being able to improve your situation, and that's any of us, and establishing their goals. So physical, whether it's exercise, therapy, rehabilitation, it's about putting you back in charge of you. It can be hard or easy, but I'm telling you right now, make it easy. What's the worst that can happen is you didn't do enough, fine, next week you can do more. Rather that than you were setting yourself back. And this was, I love the internet because you'll see these quotes and they're attributed to a variety of different people. I think I saw 4 or 5 different people say the same quote. But regardless, if you do what you love, you'll never work a day in your life. If you're doing things that you want to do, it's not work. But if you don't want to do it, if it's not working towards something that you want to accomplish, then it's going to be drudgery. So make it fun. Try and decide on what it is that's going to be important to you and work towards that, or make an effort towards that, because that'll make the difference in your overall health and well-being. So thank you very much. Appreciate you.